Thank you.
First and foremost, I want to start by saying how grateful I am, everybody is, to the work that you guys are doing out in the field. My neighborhood is filled with cowbells and drums and people banging their pots and pans and screaming, and we don't live very close to each other, but we sort of have a canyon, so it's kind of beautiful to unite in that way in support of what you are all doing. So I'll start with a thank you, and I know a thank you is not enough, but I'm going to start with one anyway. Well, I would like to begin by you guys introducing yourselves, telling us a little bit about who you are, where you come from, what kind of work you're doing right now. Carol?
Oh, hi. So Lisa, I'm Carol Lightle. I've been a nurse since 2001. I work here in Seattle, Swedish Medical Center in Issaquah, and we were actually picked to be the COVID center, unfortunately, here in Seattle area. But, you know, I've been working as a charge nurse for a while. I belong to SEIU 1199 Northwest, which I'm really grateful that we're a part of that union to help us through this crisis, to fight for safety and standards as we go through this pandemic.
Yeah. I have to say I'm a union member as well. I'm an actor, and I'm actually in like 3 different unions, and I'm very pro-union, and I know how important that kind of work is right now. I think we've had a lot of long complaints going way back, especially for healthcare workers and low-income wage workers, why what you're doing doesn't get paid well enough, because it's so vital to our survival. So I'm happy that we're going to talk a little bit about that today. Okay. And Pat, hello.
Hi. How are you?
Good. How are you?
I'm good. Thank you. My name is Pat Diaz. I'm a registered nurse, and I work at a local hospital in the orthopedic surgical unit. I am a member of 1199 SEIU UHE Florida Division. I've been a nurse for 23 years, and I must say this is the scariest part ever that I've ever experienced.
Pat, do you feel, explain that a little bit more so people can understand why you are feeling so unsafe?
Okay, so my entire career, I've been trained to go in with gun blazing to take care of our patients no matter what it is. I'm the person that has been my dream is to do a MacGyver procedure with the pen in the trachea. But you know, that's to save someone. And the problem, what's making it so scary right now is that I am not being provided, we are not being provided with what the tools that we were given and trained to use in order to do our job safely and efficiently.
So you're in an orthopedic wing, and yet still, even within that part of the hospital, you are under threat. Are there?
Well, my unit is now closed because there's no elective surgeries right now. So once our unit is closed, we're floated where we're needed, which most of the time is the unit where the COVID patients are kept.
Right.
Because we have a floor section off for the pending and tested positive patients.
Well, and Carol, you were in the original epicenter, I guess, up in Seattle. So you've definitely seen seen the brunt of this virus as it tears through our medical system. Can you speak a little bit to your experience?
Yeah, you know, Lisa, it's still a very stressful time, but, you know, we were the epicenter here in Seattle, and not only scary and stressful, but it's the first time actually in my entire career that I actually questioned, am I gonna come home? I have an 8-year-old son and a husband, and the whole time I've been a nurse, you know, this is our calling. We don't need thank yous, we don't ask for those things. It's just things that we do because it is our calling, and we need to be there for our patients. So that was the first time I really questioned mortality, for myself and my family, my coworkers, and also stressful because we need to ensure that we're doing everything that we need to do to not transmit this virus, and also to be able to come home and not bring anything home with me. So I had a system where, you know, I'd go into work, wear my fresh clothes, a different pair of shoes. I bagged everything I needed to wear. I'd go down to the ground level locker room, put on the green scrubs, did that over and over again, which took more time, but it was something that I needed to do religiously to ensure that I can also keep the people that I love at home safely, especially my 8-year-old. And so my husband was even scared for the first time, asking me not to go to work. I said, that's absolutely not possible. We need to take care of our communities and the people that I work with to make sure we're safe. If we can't be there at the bedside, you know, it really dictates how well our community are going to come out of this crisis. So that was just a question of mortality. And the most profound thing during this process is also realizing that after a week or two of being in this war zone, we didn't have the proper PPEs, and that they're rationing them out. So for nurses, our ability to come to our bedside to ensure that we have the proper PPEs, you know, it's like going to war and we don't have those. And also it limits our ability to really give the care that we need to our patients, because you want to limit the viral load, meaning that if you're in there longer, you're increased risk for the viral load. And so we have population of cancer patients on my floor, as well as patients that are demented coming from nursing homes. And some of those patients came from the nursing home where this COVID started in Seattle. So you can really sense that we were all scared at the bedside. But, you know, with all the outbreaks we've had previously, the way they were handled by federal government with grace and humility, it makes a huge difference in coming, you know, putting our people together and feeling just safer. But to not have the necessary supplies that we need, and we are reusing them. We're wiping our shields with microbial, antiviral. We're having to repurpose masks, which we've never done before. And then we also distrusted the fact that the WHO was saying now this is not airborne, it's droplet. So as healthcare givers, we were really scared the fact that CDC all of a sudden downgraded our PPEs, which we were not really willing to do that, because the WHO is the World Health Organization. They have less resources. We're a first world country, and I could not believe how profoundly that this is happening.
Have you guys had access to that crazy machine that is sterilizing all the masks all at once?
No. So the process now of repurposing the mask is we put these in like a garbage bin lined with plastic. But here in Seattle, you know, it's Earth Day, right? Earth Week.
Yes.
But
there's so many things that, I mean, there's so many products I'm using that I would never use.
Yeah. So I mean, we're, you know, as caregivers, we not only need to be conscious about how they're repurposing these masks, they're spraying them with chemicals, but we also want we want transparency in what kind of chemicals are being utilized, because they're carcinogenic. And not only that, we have to uplift everyone. You also have to be concerned when they're repurposing these, are the people that are spraying these in those places also safe?
Right. Oh, because they're around so many chemicals.
Absolutely.
That brings me to another point that we see coming up a lot right now, which is sort of the racial imbalance, the racial representation in illness. And
Yes.
as it relates to Earth Day, how much sort of innate racism there is in environmental issues in terms of like where you put fracking, where you put factories, where you put it in neighborhoods that people don't have the money to fight. And so those people end up with, would you agree with that? They end up with more health problems.
Absolutely.
And more vulnerable.
And I think I hope the positive thing that will come out of this, not only seeing how we are as a country and the federal government level, how unprepared we are, like we are a huge failure in this, but hopefully we can come out of it positively and also really realize that the disparities in our healthcare system has not just started. I know it became more apparent when they started having the outbreaks in Detroit, but now I'm seeing a positive thing that people are finally seeing that these disparities can really impact how well or how poorly we are going to be able to take care of our community.
So when we look at the sort of the problems, the structural problems, so that we can move forward in a way that is better, because this pandemic is not going to go away overnight. I think we'll probably have waves of it. To like better prepare for the next wave, let's say. How do you feel about, low-income workers, about paid sick leave, about, all those issues that I think speak very much to what's happening with healthcare workers?
So as far as the low-income worker and people of color, we have most of the comorbidity that would make us more susceptible to contacting this virus. So a lot of us are in healthcare, whether it's nurses or dietary workers, environmental workers, because they have to clean the rooms when the patients leave. So we're all exposed. And so it affects us and our community because, there's so much unknown from this virus. There's so much that we don't know. We here in Florida haven't gotten to the peak of it yet. They're predicting the next few weeks will be when we reach our peak. So, but even now, they're starting to pull back equipment from us.
It's crazy.
They're changing.
Florida, it's unspeakable what's happening in Florida, and
yes,
the way the governor's managed it. It's really disgusting. And I can't imagine what it's like to not only be a healthcare worker in this time, but to be one in Florida where they're dealing with the way they are so poorly. And there's such an enormous community of senior citizens in Florida. So many people go there
exactly.
to retire.
Because a lot of these patients are coming from nursing homes,
yeah.
and the nurse is the only person allowed in the room. So we're everything to these patients, and you have to do everything by yourself. So
are you doing practices like connect longer IV tubes so that it's connected outside the room, so you don't have to go in as often, or?
No, everything's in the room.
Everything's in.
Everything's in the room. So even the blood draws, we have to do the blood draws and, everything you can think a patient needs, the nurses who's doing it, because they're the only ones allowed in the room.
Yeah, and the only person to be with them if they're not making it.
Exactly.
And we're going crazy just bringing our groceries home. I can't imagine what it's like going home to your family from a hospital.
It makes it, I feel more for my coworkers that have the smaller children, right? Because there's no way you can quarantine yourself from your baby when you get home, right? And you got to make sure, so I have several of them because, a lot of young nurses are out there now. I'm close to retirement, so right. My kids are grown, but there are a lot of younger nurses out there with young families, and they have to worry about when they go home, what are they going to bring home to the babies? What are they going to bring home to their spouse who works elsewhere? And, he has to worry about his coworkers, So I have a couple of my coworkers said that they have to ask for a leave of absence, or they're going to quit the job because they can't put their spouse and his work at risk.
Right.
You know, because we're considered high risk at this
Do
point.
you have access to testing yourselves yet over in Florida?
Yeah, if you want to sit in a long line,
Oh,
because they're like, in my area, there are 3 parks
but not
that
special lines for healthcare workers. That's not available yet.
No, not, well, they say healthcare workers can come, but it's not exclusively for healthcare workers.
Right. So what would you, assuming we're gonna maybe have a moment to take a breath, maybe in a month, I'm probably seeing another wave because most likely people will go back to what they're used to a little too quickly. I mean, it's human nature. What would you like to see change in that time? Can the union step in and help, or is this more of a federal government thing? Like, what are the most important things that you'd like to leave people thinking about in terms of what we need ASAP to get ready again for another wave, even though we're still in the middle of this one? What can we do when it comes back? Yeah, Carol.
Yeah, for me, you know, this really needs to come from the leadership of our federal government, not just leaving it from every state to fight for these supplies that we need. So I'm hoping, I mean, since we started the first cases here in our emergency department in Seattle, I've heard, oh yes, there's these supplies, you know, a stockpile. I literally did believe that, and to this day, I'm still looking to see where that stockpile is.
Right.
I mean, we're working through with our union to, you know, to get what we need. Right now, we're doing repurposing, but it needs to be with the leadership of our federal government. We need to, I mean, people went to war back then and spent billions of dollars in just one war. Why can't we do this that's really basic for our healthcare workers?
That's right. I mean, I agree with you. We have 50 states. There's like 50 separate countries. And if everybody behaves differently, it's not going to work. We have to move forward.
Absolutely. We have to do this together, and we need that leadership to come from the White House.
Yeah.
And unfortunately, it's not there. And
yeah. Yes. Pat, did you have anything to say to that?
I'm basically, that's exactly what I was going to say. The leadership need to come from the White House, but I think we should start with testing all healthcare workers. That should be a mandatory thing, because we're the ones that's going from patient to patient. We need to make sure that we're healthy in order for us to take care of everybody else. But we need to start there, and it needs to be available. The testing needs to be more available to us.
Have you guys heard about different tests being more reliable than other tests or anything like that?
We don't know. We don't know. There are so many different ones.
Yeah.
You know, we were really thankful because initially when COVID came to our healthcare systems here in Seattle, it was taking 3 to 5 days just to get the results back. So now we've really sped it up with the Abbott laboratories, and they're coming back within 3 to 5 hours, which is we're able to take care, we're able to ship up patients a lot faster. And so, you know, we are freeing up ICU beds here in Seattle more because of the faster testing turnover with those tests. So we're really grateful for that.
And do you know for how long people are shedding virus after they come out of the hospital?
Usually from the time that they showed symptoms, not the time they, you know, become positive. We're able to send patients home even though they've tested positive, but they have to go home well enough and be able to isolate a total of 14 days. So they still have to self-quarantine, when they go home. But it's really great to see patients get better. But unfortunately for the older population being on the ventilators, they're on ventilator for about 3 to 4 weeks. And about 80% doesn't make it alive once they're on the ventilators.
Yeah, the ventilators sound terrifying, honestly. I've read some horrific reports of the experience of being ventilated. But I mean, listen, you have to move forward assuming somebody's going to be in that 20% survival rate. And Pat, how do you feel this experience has personally affected you? I mean, not the fear, beyond that, like when we get past this, has it changed your, any behavior in your own life? Has it, and what is it that you would like to see changed more broadly?
Well, what I have noticed is that this virus is not prejudiced at all.
Right.
It does not matter what walk of life I come from. It does not matter how much money I have or the color of my skin, because we're all affected.
Right.
We're all affected. This is one time that I can say that we can go and see each other 6 feet apart, but we realize that we're both having the same fear, because I think just about everybody knows someone that's affected in some way or the other from this virus. So it does make us know that we're all one. We're all one brother and sister.
Yeah, I think that's another part of the message, is that because it's all so interconnected, if we make it impossible for one group to take care of themselves, to get good food, to have time to rest, then we make all of us vulnerable. So that we are as vulnerable as our most vulnerable. Anyway, you guys have been wonderful, and I know that your schedules are outrageous, so I don't want to keep you for much longer unless there's something imperative that you think we should add to our conversation.
Gosh, thank you so much, Lisa, for taking this time to talk with us.
Yeah, it's my pleasure.
Thank you.
My pleasure. I'm honored.